To warm up before you start interpreting for this simulated session, that is going to include a patient and a provider, let's try a vocabulary exercise. On your screen, you see the cheat sheet or a list of vocabulary that will show up in this simulated session. As a warm-up, I will be listing either terms or phrases that will come up in the simulated session. As I go through them one by one, interpret or say the term or phrase in your language of service. Write down any that you don't know. Do this without looking at your screen because the screen will have the answers for you. When you are done, go back and take a look at the ones you were not sure about or ones that you did not know how to say in your language of service. Study them, learn them, and then start with the simulated session. EMR. A hint for number 1 is EMR is electronic medical record. Cardiologist. A hint for cardiologist is the doctor that specializes in the heart. Tightness in the chest or chest tightness. Sharp pain. And dull pain. Exertion. A hint for exertion is, another way of saying it is while you are active. Jaw. Intense. Palpitations. A hint for this one is make sure that you do not confuse palpitations with heartbeat. Remember that palpitations are not a regular heartbeat. It can be a sensation that the heart is racing, pounding, fluttering, or skipping a beat. My heart is racing. My heart is pounding. The pain happens independent from the palpitations. Different way of saying this is the pain happens with or without the palpitations. Dizziness, lightheaded, lightheadedness, weak. Have you ever fainted? Do you ever feel like you are going to faint? The name of a medication, meloxicam. Meloxicam. Topical cream. Remember, topical cream means cream that goes over the skin. The name of another medication, Voltaren. Is another medication, loratadine. Another medication, levothyroxine, sometimes pronounced levothyroxine. Thyroid. Take the medication on an empty stomach. EKG. Remember, this means electrocardiogram. Be sure to fast before you come in for your blood tests. Come to the lab for your blood test. This test will record the activity of your heart. Electrical activity of the heart. An EKG gives us a record of the activity of your heart. Heart rhythm. Poor blood flow. Another way to say poor blood flow is inadequate blood flow. Ischemia. And remember, ischemia refers to an inadequate blood supply to an organ. So ischemia is a condition of an organ not receiving enough blood supply. Blocked artery, narrowed artery, structural problems or problems with the structure, heart chambers or the chambers of your heart, catheter, heart catheterization, non-invasive. Electrodes. You do not need an appointment. Patients are seen on a first-come, first-served basis. You do not need an appointment. Patients are seen on a first-come, first-served basis. First-served basis. Caffeine. Ounces. Be mindful of your activity. Another way to say be mindful is pay attention. Short of breath. Crushing chest pain. Emergency room. Pulse. Implantable device. Regimen. Another way to say regimen is a prescribed course of medical treatment or prescribed medical treatment. Diuretic, anticoagulant, diuretic, vasodilator. Paper gown, leads, also sometimes they are called cables, tablet. Take a moment to review any terms that you need to review, any terms that you got incorrectly or you needed to look up. Before you start the interpreting practice, be sure that you have something to take notes with. Be sure that your recording tool is working. Be sure that you are able to pause or rewind the video if you need to get a repetition or more time for interpretation. And be ready to submit your recording for credit. The simulated session will start now.
I'm pulling up your chart here on EMR. What doctor referred you to me?
Доктор Смольц направил меня к вам из окружной клиники на 64-й улице. Он наш постоянный врач. Мы все ходим к нему. Я, мои дети и муж.
Do you know why he asked you to make an appointment with a cardiologist?
Я обратилась к нему из-за боли в груди. И иногда, как я ложусь, у меня ощущение, как будто кто-то давит мне на грудь.
How long ago did the pain and tightness in your chest start?
Где-то 2-3 недели назад. Точнее не скажу. Я так занята своими внуками, что иной раз не знаю, какой сегодня день.
Can you describe what the pain feels like? Is it sharp or dull?
Боль появляется неожиданно и кажется, будто меня чем-то прокалывают.
Does anything make the pain worse, like exertion?
Я уже не молода и присматриваю за 4 внуками. А они такие подвижные. Когда я бегаю за ними, то чувствую, будто сжимает сердце, и мне трудно дышать. Может, это из-за возраста? Я стараюсь их воспитывать, но они же дети.
Four grandchildren, that is a handful. Sounds like you're an amazing grandma. Do you feel pain anywhere else?
Иногда еще бывает боль в спине, в плечах и в шее, вокруг моей шеи и подбородка. Я перестала поднимать и носить детей, потому что от этого грудь болит еще сильнее.
How intense does the chest pain usually get, on a scale of 0 to 10?
От 1 до 10?
Okay, 0 means you don't feel any pain. Everything is great. And 10 means you're feeling the most intense pain you can imagine.
Я думаю, около 6.
Do you have palpitations? Like a feeling that your heart is pounding or racing?
Да, иногда кажется, будто сердце выпрыгивает из груди, и я чувствую, как стучит у меня в ушах и в горле.
Would you say this happens every time you exert yourself or sometimes when you exert yourself?
Не всегда, но обычно это бывает, когда я в спешке, или когда быстро иду, или нужно что-то поднять.
How long do the palpitations last? Would you say they last less than 30 seconds, more than 30 seconds, or more than a minute?
Оно длится недолго, где-то меньше минуты, но оно очень сильное и пугающее. Иногда я даже останавливаюсь, если что-то делала, чтобы передохнуть.
And does that help?
Да, если я присяду на время, то помогает и боль стихает, но мне нужно именно сидеть, потому что если я лягу, то грудь будто сдавливает.
Are the palpitations usually accompanied by the pain, or do they ever happen independent from the pain?
Обычно и то, и другое появляется вместе.
Do you feel any other symptoms like dizziness or feel lightheaded?
Иногда один раз или дважды мне приходится присаживаться из-за головокружения или слабости, и я боюсь, что упаду.
Have you ever fainted?
Нет,
Okay. Elena, did you bring your medications with you or a list of the medications you're taking?
да, они у меня с собой.
Perfect. Thank you for bringing them. Let's see. What do you take meloxicam for?
Его прописали мне из-за моего артрита в коленях и спине. Доктор сказал мне принимать его дважды в день при необходимости. Еще мне прописали крем от боли Вольтарен, но я не принесла с собой его. Он у меня кончился.
Okay, and loratadine is for allergies. And levothyroxine?
Да, это от щитовидной железы. Принимаю таблетку по утрам, натощак.
Do you smoke, Elena?
Нет, никогда не курила.
Good. I'm going to order a few lab tests to take a look at your cholesterol levels, check for anemia, and evaluate your thyroid function. I'm also going to order an EKG. You will need to come back to do the test because these tests require that you fast beforehand. You can take your thyroid medication, but don't take or eat anything else before you come in. The lab opens at 7:30 in the morning. I recommend that you not eat anything after midnight the night before and come as early as possible the next morning.
Хорошо.
Have you ever had an EKG?
Не уверена. А что такое ЭКГ?
An EKG is a test that records the electrical activity of your heart. That record helps us assess your heart rhythm. We may also be able to see if there is poor blood flow to your heart muscle. That's called ischemia. The EKG also helps us detect blocked or narrowed arteries and any structural problems with the chambers of the heart.
Это примерно как катетер в ногу вставляют.
No, that's called heart catheterization. An EKG is non-invasive, and it's done using electrodes that are placed over the skin on your arms, legs, and chest.
Мне нужно что-нибудь сделать перед тестом? Надо его пройти в тот же день, что и лабораторный анализ?
It's up to you if you'd like to do it the same day. You don't have to do anything to prepare for the EKG. Just remember, there are no appointments for the lab or the department where the EKG is done. Patients are called on a first come, first served basis. Mornings are usually the best time to come. I'd like you to come in for the test no later than next week, so I can see you in 2 weeks and discuss the results with you. I'd also like you to limit the amount of caffeine you drink in a day to 1 cup per day. Do you drink coffee?
Да, мне надо выпить чашечку кофе по утрам.
Okay, so just 1 cup a day, no more than 6 to 8 ounces.
Только вы, если не запретите мне пить его совсем.
I wouldn't do that. 6 to 8 ounces is okay. I'd also like you to try to minimize your activity. I know you said you watch your grandchildren, but I'd like you to be mindful of your activity and try to take it as easy as possible.
Хорошо, я поговорю с детьми.
Great. Tell them to take it easy on Grandma. In the meantime, if you get extremely short of breath or experience crushing chest pain that lasts more than 5 minutes, I want you to come into the emergency room if someone can drive you, or call 911 if you're alone.
Хорошо.
Okay, so we'll see you in 2 weeks.
Спасибо, доктор.
Can you verify your first and last name and your date of birth, please?
Елена Анжела. Родилась 8 апреля 1962 года.
Thank you. You can put your purse and coat down here. Have you ever had an EKG before?
Нет, раньше никогда.
Okay, the entire test will take about 5 minutes. I'm going to ask you to undress from the waist up and change into this gown. Leave the opening in the front. I'll give you some privacy to do that. When I come back, I'm going to place some stickers on your arms, chest, and legs. Let me see your shoes. I'm going to ask that you take your shoes and socks off as well. I'll attach one of these electrodes to each sticker. The electrodes don't have needles, so no poke, no pain with this test.
Хорошо, а то я не люблю иглы.
Yeah, so you shouldn't feel anything. I'm going to ask you to sit still once we start the test, and at some point, I may ask you to hold your breath for 5 seconds. The test is going to measure the electrical activity in each part of your heart, how fast your heart is beating, and it will also tell us if you have a regular or irregular pulse. Do you know why they ordered an EKG? Is it part of your routine physical exam, or were you having symptoms?
Мой врач отправил меня к кардиологу, потому что у меня были боли в груди и сильное сердцебиение.
Are you feeling chest pain, palpitations, or shortness of breath right now?
Нет.
Do you have a pacemaker or any other implantable device to support your heart or circulation?
Нет.
Do you take any heart medication or medication to lower your cholesterol?
Нет.
Does your doctor have you on an aspirin regimen?
Нет.
Do you take a diuretic, sometimes called a water pill?
Нет.
How about an anticoagulant or vasodilator?
Нет.
Did you take any medication today?
А я принимала. Да, лекарство от щитовидки. Врач сказал мне, его можно.
Do you know the name of the medication?
Да, это левотероксин, но доктор сказал, что мне его можно принять, и он никак не помешает анализам.
Oh, yeah, it's fine. These are questions I have to ask everyone. Okay, I'm going to step out and ask you to put on this lovely paper gown. Leave the opening to the front. Only undress from the waist up, and take your shoes and socks off too.
Лифчик тоже снимать?
Does it have an underwire?
Да.
In that case, I'll need you to remove it as well. When you're done changing, please sit here on the table. Knock, knock. Can we come in? Are you dressed?
Да, заходите.
Okay, I'm going to have you lie back and get as comfortable as possible. Let me know if you need me to raise the head of the bed.
Да нет, все хорошо.
Okay, I'm going to ask you to untie the front of the gown there so I can place the stickers on your chest. You don't have to open it all the way. I'll keep you as covered as possible. Now I'm going to attach an electrode to each sticker.
Хорошо, спасибо.
I'm going to roll up your pant legs so I can place one near each ankle. Actually, I'm going to roll them up a bit higher and put the electrode a bit higher up on your leg. Good. I'm going to connect a lead to each electrode pad. Okay, how are you feeling? Are you warm enough?
Все хорошо.
Good. I need you to lie very still. Don't move or talk. This will be very quick.
Хорошо.
And that's it. I'm going to remove the electrodes now.
Уже все? Так быстро?
That's it.
И как все прошло, вы скажете мне, если что-то не то?
The information from the test will be sent to the doctor who ordered the test, and they will discuss the results with you.
Но вы мне можете сказать, все хорошо? Мне не о чем беспокоиться.
I'm in charge of performing the test. Then your test needs to be read by a diagnostic radiologist, who then sends the results to your doctor, and your doctor will discuss the results with you.
Я понимаю, но раз вы видите результат, вы мне можете хоть что-то сказать?
Mrs. Angelo, the information is simply not ready yet. Do you have a follow-up appointment already scheduled with your doctor?
Да, на следующей неделе.
Good. Your doctor should have the results within 48 to 72 hours, which means he or she will have it by the date of your appointment so they can discuss it with you. If your appointment is for more than 3 days from now, you may be able to call your doctor and see if they can discuss the results with you over the phone before your appointment.
Хорошо. Спасибо.